Welcome back to the Invisible Science of Smiles. I'm Dr. Bueno, Toro, Principal Dentist of VIP Dental Clinic. Today I would like to focus on something that most people never see. And yet, it could completely change the way you think about your oral health. Have you ever been told that you have a cavity and wonder, how did this happen? Or maybe your gums started bleeding, your breath changed, or your tooth broke, and suddenly you need some treatment. Most people think that that's where disease started. But what if that's simply the day that you notice it? Because disease doesn't usually begin with pain, or with bleeding, or with a cavity. Those are often the consequences. The real story started much earlier. Imagine walking into your house and finding water all over the floor. You don't blame the puddle. You start looking for the leaking pipe. The puddle is only the evidence that something has been happening behind the wall. The same thing happens inside our mouths. A cavity, bleeding gums, bad breath. They tell us that something has changed. But the question is, what is it? What has changed? This is where microscopy changes the conversation. Traditionally, we dentists use clinical examinations and X-rays to diagnose disease. These are essential tools, but they mainly show us the damage after it has already occurred. Microscopy allows us to look at something different. It allows us to look at the environment where disease begins. Because your mouth isn't just teeth, it's an ecosystem. A healthy mouth isn't a mouth without bacteria. That is impossible. A healthy mouth is a mouth that is in balance. When that balance changes, the ecosystem changes. And that's when the problems begin. Factors like stress, poor sleep, smoking, dry mouth, frequent sugar intake, certain medical conditions and medications, poor oral hygiene, and even mouth breathing can influence that environment and make it change. Most of the time, you don't feel it. You don't see it. You simply carry on with life while those changes quietly continue. Until one day, something is going to become visible. This is the reason why I became so interested in microscopy, because I wanted to understand what happens before I can see the damage. For almost 6 years, I've been looking at samples from patients under the microscope. And one thing that happens almost every time when the patient looks at that screen and then they say, "Is that in my mouth?" Then comes the next sentence. "Nobody has ever shown me this before." At that moment, everything changes. Because now oral health isn't just something that we dentists are talking about. It's something that the patient actually can see. They can see the movement, they can see the living bacteria, they can see the different patterns. They see that there is an entire ecosystem they never knew or were aware that it existed. And suddenly the conversation changes. Instead of asking, "What filling do I need?" they start asking, "What can I do to make this better? How can I prevent that I get disease?" And this is a completely different conversation. This is why I love microscopy. Not because it replaces dentistry or X-rays or treatment, it doesn't. But it's because it helps people understand. And when people can understand, they can make better decisions. Every day, I have patients coming into my practice saying, "Every time I come to the dentist, I need something done." They need another filling, they need an extra clean, they need another repair, and they are always wondering, so have we only treated the puddle? Or have we found the leaking pipe? Because if we don't change the environment that allowed the disease to develop in the first place, we shouldn't be surprised when the same problem returns. So that's why I believe prevention begins with understanding. Understanding your mouth, understanding your habits, understanding how your oral hygiene is, and understanding your own biology. Because once you can see what is happening, you finally have the opportunity to change it. And that one might be one of the most powerful things in healthcare. In our next episode, we will explore another invisible factor that influences oral health in ways that people never imagine. Until then, stay healthy, stay curious, and remember, you cannot treat what you cannot see. Microscopy helps us understand the mouth at two levels, the biological level and the structural level. So once we understand what is happening in the ecosystem in our mouths, we can make informed decisions and have more clarity about the next steps. So stay tuned. If you want more information, visit our webpage at www.vipdentalclinic.com.au. And if you like this video, please subscribe to our channel. Thank you.